Assessment, Unit 3, Care of the Aging Adult. This is Martha Olson from Iowa Lakes Community College. We left off in Unit 1 discussing the different body systems and what happens with aging. We will start now with reproduction and know that women, that decline in estrogen affects many parts of the body, including the brain, some of the cognitive changes. We oftentimes see insomnia and depression as a result of that decline in estrogen levels during or after menopause. With the decreased estrogen, we know that the skin contains less collagen and becomes very thin. Sweat and sebaceous glands become dry, hair follicles become dry, and those bones lose calcium. So we'll pull that information with us then to the musculoskeletal unit when we talk about osteoporosis. The breasts lose some connective tissue but gain adipose tissue. The absorption of nutrients becomes less efficient. So lots of body changes for the female, including the vagina, which has loss of mucosal layers, decrease in discharge, loss of lubrication, so vaginal dryness. pH levels also change, and they switch more from the acidic to the alkalinic environment. So vaginal infections are more likely or prominent for the older female as a result of changes. For men, the benign prostatic hypertrophy, or BPH, that prostate is enlarging, causing urethral blockages. Usually a man will tell you the first symptom of that was dribbling with urination. We also see tissues fibrose, and that can cause problems for the male to have an erection. Most of the problems can be linked also with medications, especially blood pressure medications and other disease processes. The nervous system, we know that plasticity is that ability to lengthen or form new neuronal connections onto the available existing ones or neurons that are there. That ability for learning new information diminishes with age. With neurotransmitter changes, we see the change in that neurohormone or neurotransmitter acetylcholine having an effect with Alzheimer's disease. Those neuroendocrine changes with age have the potential to affect many of the body systems because of the changes in the hormones. When we look at vascular changes, we see that the decreased cerebral blood flow becomes more prominent with aging, less elasticity, and increased fibrosis or stiffening of blood vessels, making it more difficult for blood and nutrients to get to the places they need to go. And then that blood-brain barrier that is the protection of the brain from toxins or chemicals starts to break down and degrade, so the person has more ability to have changes in the brain or cognition as a result. Plaques and tangles also go with vascular changes, and they are the main protein associated with neuro. Tangles is a process or a protein called tau, T-A-U. It's a phosphoprotein that supports the microtubule stability, and that tau protein undergoes abnormal breakdown or phosphorylation and increased density. When we look at the word free radicals, I think of that when we teach nutrition and we talk about the unpaired electron in that outer shell of the total electron. Oxygen is that major molecule of making free radicals, and that oxidative stress and oxidative damage then are a result and cause loss of structural integrity, cell dysfunction, and nerve degeneration. So looking at free radicals, they can play a part, and there is even a theory in the book that talks about the process that we have with free radicals in the body. As we look at a stroke, because it goes with vascular changes, the first question when somebody comes into the ER with a possible stroke is, do they have a bleed, or is it a blood clot causing their problems or symptoms? As we look at prevention of stroke, always think of primary, secondary, and tertiary. Primary is looking at that population and getting them to make positive changes before they have a stroke. Secondary is they've had a stroke or early signs and symptoms to report, early intervention. And then tertiary is that rehab. Does that person, now that they've had the stroke, have the ability to get some of their strength back, their speech back? So stroke is something, unfortunately, that is not just related to the elderly, but it is more prominent in that population. So I bring it up here. As we assess the vascular system, blood pressure is one of the assessments that we do on every patient, but we also want to look at that vascular system as far as color, motion, and sensation. You know, when you look at the extremity, is it arterial or vascular? Is it pink or is it white? What is the color of that? Are they able to move it? And when I touch or do something with that extremity, do they have the sensation to say your hands are cold or that pin is sharp that you're putting there? We know where all the pulses are that we need to check, and it just depends on at what level of an assessment we are completing. When we look at Potter and Perry, we can compare and contrast venous and arterial. And when we look at the venous, that's very typical of the patient that you see in long-term care that has a lot of venous insufficiency. On table 3026, it compares and contrasts the two. I would suggest you look at those because arterial circulation is shiny and more of a pink circulation, whereas venous, you notice that dark area, and it looks like you should be able to scrub that off, but you can't. When we look at the peripheral nervous system, we know slower nerve conduction speed from the breakdown or the degradation of the myelin sheath that coats the axon. Calcium is really that key regulator of nervous signaling, and from the excitability to the neurotransmitter release, calcium plays that important role. When we look at somatic motor neurons, slower relay of messages. What this really means is the older they get, the slower some of their reaction is. And so when they're driving and a deer jumps out in front of the car, are they able to put their foot on the brake and get stopped in time? And just the slowing of some of these nervous responses can impact safety for a lot of our older adults. Looking at the autonomic motor neurons, again, we think about what is the difference between sympathetic and parasympathetic. Remember, sympathetic is that fight or flight, when the body goes into overdrive trying to maintain the stress that they're under. And parasympathetic is called rest and digest. And parasympathetic is where the body relaxes and the GI system can digest what you just ate because it doesn't feel like it's under stress. As we look at these motor neurons, then the nervous system really does remain the most integral organ system in the body due to its influence on every other body system and every other organ that we have. Endocrine, lots of changes. Growth hormone is of great importance because it contributes to age-associated loss of muscle mass. When we look at decreased bone formation, reduced protein synthesis, loss of tissue repair, declining immune function. So all of the hormones might change as a result, except the thyroid. That really does remain unchanged with the aging process. The adrenal gland, remember the adrenal cortex is what makes the glucocorticoids, mineral corticoids, and sex hormones. Glucocorticoids, that cortisol decreases with advancing age, but the body compensates by not excreting as much from the body, so they really should maintain fairly normal cortisol levels that maintain blood sugar. Mineral corticoids are with fluid retention and with sodium loss and hyponatremia. And as we look then at the sex hormones, low levels can be associated with diabetes, cardiovascular disease, Alzheimer's, and cancers. And then the adrenal medulla is your epinephrine and norepinephrine, and those are very potent vasoconstrictor hormones that are part of that sympathetic fight or flight. When we look at the muscle, we know that there is a reduction in the muscle mass. Sarcopenia increases in functional disability and making a person more fragile or high risk for injury and falls. The greatest loss really does occur in the lower limbs, and there are many things that factor into that. Genetic, lifestyle, and other factors determine how much muscle mass is lost. If this is a person that's working out and exercising and is maintaining a fairly active lifestyle, they should regain and retain most of their muscle mass as the aging process happens. Tremors and weakness are part of the motor units that are responsible for contraction of the muscles, and so we might notice some more tremors and weakness as a result of that. When we look at skeletal, that estrogen deficiency really is a key in that bone loss. When we look at bone strength, a lot of it has to do with lifestyle changes that that person encountered their whole life. Women past menopause, it accelerates, but we also look at their weight, other risk factors that go along with osteoporosis. Somebody that's dieted a lot, had low dairy product or calcium intake throughout their life. When we look at bone fractures, we know that different bones, and they occur differently in the elderly than in younger people. For the older person, it's typically next to a joint. For the older person, it's also much more difficult to prevent or repair. Recovery from a fracture often occurs very slowly, and for many of them, a hip fracture or a pelvic fracture is that downward spiral event. As you look at the picture here of the foot, the classic sign of a fractured hip is that fractured hip has a foot that's rotated outward and is a little shorter. So we want to keep that in mind as we think of assessing a person if they have a fall. Do they have a hip fracture? Does it need to be x-rayed to rule it out? Think about the risk factors for osteoporosis. It's usually Caucasian women, small framed, less than 127 pounds, maybe a woman that is taken a lot of steroids through the years because of asthma or other health conditions, all put that person at very high risk for having osteoporosis. The joints, we know for the elderly it's more difficult to move and the range of motion is often reduced. There's increased injury, so preventing injury with continual exercise and the ability to keep moving is important to prevent that. With disease, we see the osteoarthritis being the most common form, with breakdown and weakening of the cartilage to that, bones that might rub together. Enlargement of joints and decreased synovial fluid can also impact how the joint moves. We're seeing today more and more joint replacements in the elderly, and that's a good thing because it keeps them mobile. If they have a lot of joint pain to the knees, and that keeps them from walking and ambulating and being active, a joint replacement is a good benefit for them. With that chronic inflammation of joints, it's the least characteristic of normal aging, so we hope that that can be identified early and taken care of. When we get to the sensory, we think of the 5 different senses. Sensory touch is one. Skin on the hands undergoes really the most change with age. We know then the feet are also affected, and that term proprioception is identifying or recognizing information regarding body movement and position. So that person may not identify different things going on around them and be able to anticipate safety, like lifting their foot so that they don't trip over the curb and gutter. Some of those types of things for depth and balance. When we look at sensory smell, we know that there is a decrease in the number of olfactory neurons and weakening of that pathway to the brain. Our concern is their inability to smell maybe a harmful gas or smoke in the house. They might receive less enjoyment from food because it doesn't taste and smell as good as it did previously. When we look at taste, the term that is used is hypogeusia, and that's a decrease in taste, and it decreases slightly with age, and sometimes we see where our older people will add more flavoring, more sodium or salt to the food they're eating just because it doesn't taste like it used to. Detection of sugar does not change as much as the detection of salt. And we worry at this point about food poisoning. You know, when I taste food and it tastes awful and it's been in my fridge too long, I can get rid of it. But for the older person, they may not identify that it is poison and they need to get rid of it. We will start up with hydration on the next Unit 3. Thank you.